Hello, I'm Dr. Alice Locicero, and I'm president of the Alameda County Psychological Association, a chapter of the California Psychological Association and an affiliate of the American Psychological Association, the largest association of psychologists in the world. We partner with Crisis Support Services of Alameda County to provide confidential, non-judgmental, brief telephone support 24/7 to anyone who works in a healthcare setting in California. We started this all-volunteer support line when we anticipated stress and likely also trauma for our healthcare worker colleagues as the COVID-19 pandemic began to expand. We wanted to share the burden being carried by our healthcare colleagues and provide support to the frontline healthcare workers who are constantly in the center of this pandemic storm. We initially consulted with international colleagues in China and Chinese Americans working remotely with Chinese health workers, as they were the first to be seriously impacted. We learned that the most effective ways to help healthcare colleagues going through the pandemic were listening, empathy, and the techniques of psychological first aid, methods we felt quite comfortable with. As reports began to emerge about American health workers and those who work in health facilities, we saw that, consistent with the report of our Chinese colleagues, high levels of anxiety, depression, and insomnia were affecting not only direct care workers, but others who worked in healthcare settings. The pandemic brought various sources of stress, such as limited supplies of PPE, fear due to the limited knowledge about the nature of the virus, exhaustion owing to the demands of assisting large numbers of very sick patients, and emotional distress as a result of being the only companions for dying patients whose families couldn't visit. Not surprisingly, the sources of greatest stress were the worry about possibly causing a family member to become ill and the trauma of seeing colleagues become ill and even die from the virus. We have been taking calls on this line since May of 2020, and we've learned that the COVID-19 pandemic is affecting every part of American health workers' lives, including relationships with family members, friends, and neighbors, personal health and well-being, career trajectories, emotional reactions to loss, and distress over disparities in the way the virus affects various groups. We learned that health workers are discouraged when they see others, sometimes family members and friends, failing to take the pandemic seriously. Volunteers taking calls on our support line are licensed psychologists and mental health professionals, early career psychologists, and doctoral students under supervision. We have had hospital chaplains and a few nursing students who worked under supervision as well. We hold weekly educational seminars for student volunteers, and monthly meetings are available to professionals who volunteer on the line to discuss calls and also to continue to educate ourselves. This is an all-volunteer project. The expenses incurred have been funded by a combination of funds from the Treasury of the Alameda County Psychological Association and from a GoFundMe page. We are currently applying for additional funding from the California Psychological Association to increase our small but growing social media presence. Although the Alameda County Psychological Association is a chapter of the California Psychological Association, we are an independent nonprofit organization, a 501c3. All members are licensed psychologists. We also have affiliate members, including students and others with an interest in the field. Prominent in Alameda County Psychological Association's mission is to serve the public, and we do so through advocacy and pro bono work, including the support line, and also being available to respond to other local and regional disasters, including the pandemic. Other disaster response work is done in collaboration with the Red Cross and in partnership with California Psychological Association. Many of our members also provide pro bono clinical services, including work with vulnerable populations, such as asylum seekers and victims of violence. We plan to continue our efforts to serve the public via the support line. We have additional capacity among our volunteers with backup by the highly trained volunteers from Crisis Support Services. We hope that you will help us spread the word about our availability. The name of the line is Staying Strong Against COVID-19. The number to call for support is 510-420-3222. That's 510-420-3222. Thank you very much.